This program was produced by and first broadcast on Radio Hawke's Bay, a community access media station. Thank you to New Zealand On Air for making this type of programming possible.
Good morning, everybody. This is Heiko from Acupuncture on Air. Here we are at Radio Hawke's Bay again, talking to acupuncturists from around New Zealand. We're going to continue our thread and we're going to have another interview, another talk with Jason Bei from Kapiti. Welcome to the show, Jason. How's it been?
Hello, Heiko. Thank you for inviting me again. I'm happy to discuss further on this topic of neck and shoulder problems.
Yeah, no, that's really interesting because I do know it's quite common and I get a lot of inquiries for it. But firstly, just tell us about the shoulder, in particular the types of shoulder problems that you yourself can help with Chinese medicine in the clinic.
Okay, so I think my way of dealing with this, when people come, I would ask them when do they have this problem, and if that's an acute and associated with an injury, and then you would understand what the cause of, is that muscle sprain or for example, the rotator cuff tears is very common for people doing sports, or someone tripped and fell down, or overextended the shoulder muscle. There could be actually another common seen condition of the shoulder is the frozen shoulder, but normally that's different. That could be it's relating a bit of aging and underuse of the shoulder first, and then so that's kind of thing. We kind of know what's the cause and what's the type of shoulder problem.
Yeah, I know in sort of our traditional literature, like frozen shoulder in Chinese medicine is often referred to as a 100-year-old shoulder. So perhaps if you can, in very simple terms, just sort of tell us what frozen shoulder is and how it comes about.
Heiko, I'm sorry, I have some disagreement with you. It's actually, I know it's a 50-year shoulder, not 50 So that's quite descriptive of that 50 years old shoulder.
Yeah.
Actually, we see a lot of people are 40, about around 40, and most of them are female. So all of a sudden, one day, it could happen to anyone, actually, not just women or men. So whenever, just all of a sudden, one movement triggers that huge pain, and then you couldn't lift your the shoulder up anymore, and then basically it's a huge pain day and night, and also very restricted range of movement. That's the frozen shoulder. Right.
I mean, I know that the every case and every person is different, and sometimes a frozen shoulder gets labelled as a frozen shoulder when it probably should be labelled as something else. But the traditional acupuncturist has many tools at their disposal, such as we can use cupping, gua sha, moxibustion, electroacupuncture, tuina. Now, what about in your practice in Kapiti? Are you using any of these, or all of these, or some of these?
Yes. So it depends on the stage of this frozen shoulder. So I understand there is three stages. One is the inflammatory stage. So the pain is huge, and then people often take anti-inflammation pills. Painkiller wouldn't work well, and sometimes people with huge pain, they would go to the doctor and get injections. And some people got good results, but some people don't. So we call it first stage. And then in this stage, I would advise people don't get any massage, tuina, or cupping on the shoulder, because that's not ready for it yet. So the goal of the first stage, I call it inflammation stage, is reduce the pain, reduce inflammation. And so you mentioned about cupping, gua sha, and moxibustion, I think that's for the second stage, which is recovering stage or scar forming stage. So once the scar formed, and then the function of the shoulder was almost disappeared, it couldn't raise the arm, and the pain is reduced, but the function lost. So at that time, we can invigorating the blood circulation around the shoulder and trying to restore the function. So in that case, I would use all the methods you mentioned, like cupping, gua sha, moxibustion, electro, toina, whatever, yeah.
Okay. Now, what about, I mean, we know that you're also an experienced and qualified herbalist, but what about Chinese herbs for frozen shoulder? Do you use any herbs, like, say, in the inflammation stage?
Yes. So, back to the stage thing, so at the inflammation stage, that's quite helpful to, speed it up the recovery, reduce the pain as much as possible, comparing to the non-steroid anti-inflammation pills. The Chinese herbs has less side effects, and it's actually trying to help the body to get out of that inflammation quicker, easier, and better. So there is a bit of difference there. So on the next stage is, again, we're trying to improve the circulation and to invigorate. So if some people with very low energy, we're trying to nourish and tonic, the energy, and so again, it's helping the body to recover.
Okay, that's great. Now, we have a bit of time left, and I wonder if we can talk a little about neck problems. I mean, I know for myself, acupuncture is very effective for neck sprains, whiplash, and wry neck. But I'd love to discuss with you how you approach these more serious chronic neck issues, such as like arthritis of the neck or deteriorated cervical discs, or even like ankylosing spondylitis of the neck. Could you just give us a few of your thoughts there?
Yes. So it's quite important from my experience to understand the Western diagnosis. The benefit of the Western medical diagnosis is actually point to the exact area where the problem is. But then in terms of treatment, again, we come back to the alternative way, trying to help the person to be more balanced. If there is a deficiency, we will do acupuncture or herbs to help. And then we will say, okay, for example, if there is an injury, whiplash involved, so often people can have concussion kinds of headache and, the brain function. So we need to do something to help that. So to know the exact cause and the condition is quite important. But in terms of treatment, comes back to using the channel system. So I would treat that kind of condition on actually treating the foot. The bottom of the foot, for example, to restore the cognitive function and to settle the brain for the concussion, for example.
Okay.
And then, if there is some other condition, for example, involved like a blood supply, which is more the degenerative cervical vertebrae, like the narrowing the blood supply, the blood vessel and the nerve pathway. So people can have symptoms of dizzy, headache, and, referral numbness and pain in the arms and shoulder. So we have to deal with the cause and target the different kind of types of neck problems separately using appropriate...
Now, what about ankylosing spondylitis? Because, not many people have heard of it, I guess, but it's certainly common, comes into the clinic. Do you have any ideas of how you can help with that?
So often that's with very, restricted, the spine almost like it's curved. Kind of condition. So it's resulted in balance between left and right if it curves to the left. And then it's a lot of stress, and on the other side, on both sides, a different, tightness, and you can see a lot of, I've seen like you put the needles in, you've got redness come up from under the needle, which is, we call it histamine reaction. So in those cases, we often think that's relating to a yin deficiency, a tightness. People can find, may find magnesium can help, but we have a nice Chinese herbal formula to help the tightness of the muscle and release the stress. So in treating these conditions, so our strategy actually is relax the muscle and and release the heat trapped in inside of the curved side, and so to reduce the pain, release the tightness, and make the problem more manageable.
Okay, that's good. But listen, again, thanks for coming on the show, because we're getting up to the end of the time again, and I know that I always like to pick weird songs and so forth. So I've got one of them lined up, but for the next show, it'd be good if we can bring you back and we can talk about the treatment of long COVID. Now, you be up to that next time?
Yes, I'm most happy to share some of my experience on that.
That's great. That's really good. And so here we go, and we'll finish off the show, and we'll see you for the next show.
This program was produced by and first broadcast on Radio Hawke's Bay, a community access media station. Thank you to New Zealand On Air for making this type of programming possible.